Hey everyone, Dr. Greg Benkin here at Northwood Chiropractic and Wellness in Maple Grove. A common question I get all the time with my patients is, what else can I do at home to help with my spine and my spine's health, or even just my care? So we do prescriptive, meaning if somebody's coming in with a condition, a complaint, or symptoms, I want to make sure I'm giving them exercises and therapeutic exercises that we do in-house together to help them with their progress, but also stuff that they can do at home to help with their care. But on the other side of just general health and wellness, there is a series of exercises that I want to give you, and I'm going to give them to you right now. So just like your dentist is always going to give you a toothbrush and floss because they encourage you to brush your teeth for your oral hygiene, I'm going to give you that toothbrush right now. So these exercises anybody can do. It doesn't matter how old you are. You could be 3 years old, you could be 30 years old, you could be 90 years old. What we're going to do today is work on spinal hygiene. So the concept with this is when we stop moving, that's when stuff starts to degenerate. Muscles get weak. That connective tissue between each bone that's there to make sure that that disc is healthy and hydrated starts to flatten and weaken. So we know that the first sign of degeneration starting is your body just not moving. So for many people, they're sitting 8 to 10 hours every single day because they have to be productive, they have to sit, they have to do their tech stuff on their computer. That's how we have to communicate. So for many people, they're not putting their spine through a full range of motion. So there are 4 concepts behind spinal hygiene, and I'm gonna give you that toothbrush. It's number 1 here. It's movement. So with this, I want you to take your ear and bring it to your shoulder and just hang out for 10 seconds. I want you to do this for 10 seconds on both sides. And as you're doing this, I want to explain why. So there's these discs between each bone. And when we're younger, these discs have blood vessels into it. And that blood is actually able to then get the toxins out and the nutrients in. And that's why kids are able to grow so quick, so tall, and then within just a few years of their life. But then you have to be able to maintain that height, especially as you're getting into your 30, 40, 50, maybe 60. And then you start to see some people with that height start to shrink. If you already haven't switched, make sure you go to the other ear. Again, hold each side for 10 seconds. So what happens then is how do we get these discs then to maintain their height? You know, if there's no blood vessels that's getting the toxins out and then the nutrients in, we need to do it with what's called imbibition. So imbibition is those bones, they're moving and they're pretty much creating a pumping action. They're getting that disc to pretty much contract and expand, and that pumping action allows those nutrients to get in and those toxins to come out. And so when we stop moving, that's when those discs can't get the nutrients that they need and they can't maintain their height. And that's where we start to see degeneration occur. So we're going to continue on with your spinal hygiene exercises. Next, I want you to tuck your chin into your chest. When you're doing this, again, it should be a relaxed position. We want those joints to open up. We want those muscles to open up and relax as well. So again, 10-second hold. Next one, keeping your mouth closed, look up to the ceiling. Again, a nice 10-second hold. Anybody can do these. Anybody can do these. Again, you can be 3 years old, you can be 90 years old. Next one I'd like for you to do is rotate your head to the side. Again, it's all about getting those joints to move, those muscles to relax, because essentially, as I mentioned before, we're trying to get those discs, we're trying to get those nutrients into those discs pumping and moving. Let's do 10 seconds on the other side. So just like when you grew up, your parents very likely taught you how to brush your teeth. But maybe your parents, maybe their parents, or your grandparents, I should say, didn't teach their kids oral hygiene, how to brush your teeth. So if you really think back and you maybe hear some stories, you know, when did grandma and grandpa get their teeth pulled? You know, how old were they? You know, what about your great-grandparents? Do you know those stories? You know, when did oral hygiene start to become big? Well, the concept was relatively new. It was 1913, Dr. Alfred Fons, or Finesse, maybe it's pronounced a little bit different. He's the one who came up with the idea of, well, hold on, there was this guy maybe 16 years ago that found out that when bacteria eats sugar, it releases an acid. So this guy's thinking, I'm pulling all these teeth, because that's what dentists did. They pulled teeth nonstop. That was considered the dental practice. So Dr. Alfred Fons, he said, well, if bacteria can secrete acid, and I'm seeing this tooth decay that's coming from acid, you know what? We got to attack this bacteria. So he's the one who created the concept of dental hygiene. And then in 1913, he opened up the very first dental hygiene school. And since then, the dental profession exploded. So that's why with these spinal hygiene exercises, this is the toothbrush I'm giving you. Because we know that when a joint stops moving, when we start getting that degeneration into that disc, that's something that ultimately we can't reverse, but here's something we can do to prevent it from even happening. So the next series we're going to go through is the low back. With this, I want you to keep your legs straight, back flat, and let's just bend at the hip and just bending forward. Again, holding just for 10 seconds. 10 seconds just to get that pumping action. Again, I can't express it enough. It's all about nutrients. It's all about movement into the disc. After 10 seconds, let's just sit up and then extend back. Just like your morning stretch. Maybe you do it, maybe you don't do it. When you first get out of bed, you do the whole big yawn at the stretch. Why don't you just hold that stretch and let's just do it for 10 seconds. Then next, let's bend to the side. Get a nice 10 seconds. You may feel a stretch, but it's all about getting those joints to move. It's all about getting nutrients into the disc. Now let's do 10 seconds on the other side. So as I mentioned before, there are 4 concepts of spinal hygiene. One is range of motion, and you're doing them right now. The next one is we want to make sure that there's great strength in your spine. Because if a spine is holding in a great position, we know there's full range of motion, we know that those nerves are working. And then the next concept is molding. So there are 3 curves that we want to see. From straight ahead, you should be straight up and down. And then from the side, we should have 3 curves, because that's all about weight distribution. And now that is irrefutable. It doesn't matter what profession you go to, when you say what should a spine look like, it should look like that. Straight up and down when looking straight ahead, and to the side, there should be 3 curves. But the challenge is just because we're sitting for long periods of time, because of our lifestyle changes, because we're an industrialized tech-based society, our spines are starting to adjust to the lifestyle that we have. And we're starting to see a lot of people coming in with, they've lost their curves, meaning their neck is really straight, and that's putting a lot of stress and strain on those discs. And we're seeing signs of degeneration in kids as young as 15 years old. So we're seeing it in their neck, and we're also seeing their low back. Why? Because we're sitting in that slouched position, head forward, on our computer. What do we want to do? We're studying, we're on social media, we're not active out and engaging with people, moving our body around. So next thing we'll do, and last one, is let's rotate. So rotating through the trunk there, 10-second hold at the very end, each side. Again, it's all about the discs. It's all about movement and making sure that our body is well aligned. And the very last thing is, even though you brush your teeth, you still go to the dentist. So with this toothbrush I gave you, the spinal hygiene exercises, I still encourage you to go to see your chiropractor. So seeing a chiropractor, they can help identify areas of joint of not moving and making sure you're getting that movement, making sure that your spine is in great alignment and that the muscles are strong and that you're getting that full range of motion and benefit to help protect those discs. Seeing a lot of people 15 to 50 years old right now, first time ever seen a chiropractor, and their spine is degenerated. It's very challenging to fix a healthy, sick spine. It is way easier to prevent the issues before they even happen. So if you're interested in a consultation, give my office a call at 763-432-3932 or visit my website and then request an appointment online. That's www.northwoodchiromn.com. This is Dr. Greg Benkin. Here's your toothbrush. Start flossing.